Hi, my name's Michelle, talking with Dr. Sovic today on behalf of the Loveland Beacon Journal about whooping cough. Nice to meet you, Dr. Sovic. Thanks for joining us today. What is whooping cough and what are the symptoms of it?
Whooping cough is a bacterial infection, and the actual name of whooping cough is pertussis because the causative organism is named Bordetella pertussis. This bacteria is gram-negative and strictly aerobic. It is also rod-shaped and has a flagella-like structure. It does not produce spores, but it is motile. The name whooping cough came from one of the symptoms that is a cough that sounds like a whoop, and the other symptoms are a runny nose, nasal congestion, and sneezing.
That's super informative. What are the 3 stages of whooping cough?
The 3 stages are catarrhal, paroxysmal, and convalescent. Incubation time is 7 to 10 days, but the first stage of symptoms normally goes unnoticed or assumed to be such of a common cold or the flu.
How does it enter the body?
It enters the body through the nose, mouth, or eyes when an infected person coughs or sneezes.
Is there anything we can do to prevent it?
There's not much to be done in order to not spread it except keep distance from infected people and wear a mask to cover the nose and mouth and wear something to cover the eyes if necessary.
Is there a vaccine for whooping cough?
There are 2 vaccines and they also provide protection against tetanus and diphtheria. The DTaP is for children younger than 7 years old and the TDAP is for people older than 7-year-olds. And it is recommended that even if you get the DTaP vaccine as a young child, you still need to get the TDAP vaccine when you reach the age older than 7. And it's recommended for pregnant women to get a dose of it during every pregnancy. And you need a TD booster dose every 10 years. And even if you are fully vaccinated, if the whooping cough is going around your community, there is still a chance that you could get it, but the infection will be less serious.
Approximately how many cases of whooping cough are there?
For adolescents and adults, there are between 370 and 1,500 per 100,000 population, and approximately 800,000 and 3.3 million cases per year in the U.S.
What should you do if you get whooping cough?
If you get whooping cough, you should stay away from people so you don't spread the bacteria to others. And since whooping cough is a bacterial infection, it is treated by antibiotics and is taken for 2 weeks. And even if you start to feel better after starting to take the antibiotics, you have to finish off it and take all of them until you finish. And in order to make sure you have whooping cough, you get a test for whooping cough, and the doctors will swab the inside of your nose and or throat, and they'll send it to the lab, and the lab will check for the bacteria. And the doctor could also do a blood test and take a chest x-ray.
That's so interesting. What is the immune response?
The immune system develops antibodies that recognize the whooping cough bacteria, and the antibodies stick to the bacteria, which help the body's different immune cells respond to the infection.
Is there anything we can do to prevent the spread of whooping cough?
Well, you can keep your distance from people if it is going around everywhere and stay home if sick. And get a vaccine so you know that you are at least kind of protected. And like I said, wear a mask or goggles or stay away.
Oh, that was so interesting. It's really nice to meet you. Thanks for taking your time to talk with us today.
Thank you.